So this is on prescription writing, the art of prescription writing and the legal value of it. The definition of a prescription is the prescription originates from two words, pre, that means before, and script means writing, and refers to an order that must be written down before a drug can be dispensed. It is a written or an electronic direction or an order from a registered medical practitioner to the pharmacist to compounding and dispensing specific medications for patients. Functions of a prescription. It is a legal document, may be used as a prima facie evidence in the court of law. It is also a source of record. It is a means of communication between the patient and the prescriber, and it is also a therapy modality. The prescription is governed by a lot of acts. The Indian Medical Act 1956, the Indian Medical Council Professional Conduct and Regulation Act 2002, the Drugs and Cosmetic Acts 1940, the Narcotic Drugs and Psychotropic Act, Substance Act, the Drugs and Magic Remedies. The parts of a prescription, it includes a superscription, which is the heading, an inscription, which is a body, and a subscription, which is closing. The heading, as you can see, it includes the prescriber's details. It consists of the name of the prescriber, the qualification of the prescriber, the address of the prescriber, the registration number of the prescriber, the contact number of the treating prescriber, and the date. The heading also has the patient's detail, which contains of the name of the patient, the age of the patient, gender of the patient is very important, the address of the patient, the contact number of the patient, and in children particularly, the weight is very important because the pharmacist has to dispense the medicine according to the weight of the patient, and the prescriber also has to write the medicine according to the weight of the patient. In this particular patient detail, if the contact number is not available, you can have alternative methods like email ID or some form of ID has to be mentioned in the patient because the same name can be for many patients. So one particular ID has to be there for that particular patient. Now heading superscription, it is represented by the symbol RS Roman. It is always written at the beginning of the prescription. Different countries have got different, like in Egypt, it is a prayer to God of healing. It is also a symbol of the Egyptian god, which is the eye of the Horus. It is known as Horus was the Egyptian god. He lent his eye to his dead father who came back alive. It is also a prayer to Jupiter, the god of healing, for quick recovery, and in Latin it means recipe or take thou. The body includes inscription and it includes the names and quantities of the prescribed medicines. The drug is written in capital letters followed by generic name of the drug. This has been followed by Government of India and it has given in its act. I'll come to it later. The dose, frequency, and the duration of therapy is clearly mentioned. The body also contains something known as the signa. Signature or signa is usually abbreviated as SIG on the prescription. It is directions given to the patient, the quantity of medication, the number of dosage units to be taken, the number of times a day it should be taken, and the relationship to meals. Follow-up instructions. The subscription is a closing, the last part of the prescription, as you can see. It is actually the prescriber's directions to the pharmacist regarding the dosage form and number of doses to be dispensed. It also talks about the refills, how many times it can be refilled. Like over here, you can see telmisartan has been advised, and there it is written 6 times. Signature and registration number is mandatory. The prescriber's signature and registration number should be there below the prescription. And if the registration number is not written in the initially in the prescriber's details, it has to be written below. Now the prescription writing, the basic rules. Who can write a prescription? Only allopathic doctors, that means registered medical practitioners, either registered in the state or the Medical Council of India can write, dentists and vets. Who cannot write a prescription in allopathy? Nursing staff, pharmacists, practitioners of traditional, that is complementary system of medicine like Ayurvedic, homeopathic, cannot prescribe allopathic medicines. What should be the size of the prescription? It should be A5 size. Prescriber details. A physician shall write his name and designation in full along with registration particulars in his registration letterhead. In government hospitals where the patient load is heavy, the name of the prescribing doctor must be written below his or her signature. This is according to the Indian Medical Council Act 2002. The qualification. Physicians shall, as subject to the names, only recognize medical degrees. Certificates, diploma, memberships, honors which confer professional knowledge or recognizes exemplary qualification, oblique achievements can also be attached. This is the Medical Council of India, the format of prescription which it said in 2015. And as you can see, the format is almost the same, but the additional thing is that they have mentioned that the pharmacist's name should also be written over there, and the name of the pharmacy and the city dispensed should also be written there. Crosspathy. Doctors should refrain from prescribing medicines of other systems of medicine. This amounts to cross practice and is prohibited by the Supreme Court. This is a crosspathy. This is a case Poonam Verma versus Ashwin Patel. Here, the respondent number 1, having practiced in allopathy without being qualified in that system, was guilty of negligence per se. Now, this is regarding the generic medicine, and this is in 2017 with the Medical Council of India came forward. And this is what it said: every physician should prescribe drugs with generic names legibly and preferably in capital letters, and he shall ensure that there is a rational prescription and use of drugs. A rational prescription, according to WHO, is a drug should be appropriate to the clinical needs. Now, prescription for a private practitioner, which shows many drugs, polypharmacy should not be used. It should be rational prescription of prescription writing. Now, Schedule H. These are some of the drugs which are used to treat serious diseases like heart disease, anxiety disorders, and other diseases. Even some antibiotics come under Schedule H. There are almost 550 of them in Schedule H, and they have to be sold under prescription of a registered medical practitioner. And only the amount which is prescribed will be sold, no refills. Schedule X, they are addictive drugs, more of narcotic and psychotropic. Only certain category of doctors can prescribe. It needs signature and stamp. Pharmacists should maintain a register. Pharmacists should retain a copy of the prescription for 2 years, so duplicate prescription has to be given. It is kept under lock and key, and there are no refills. Errors in prescription writing. There are 1.5 million medication errors was found in 1 year in USA. There were 45,000 deaths in 1 year due to medication errors, and 25% of medication errors are preventable. The errors in medication are mainly due to abbreviation used, to the name of the wrong name of the drug used, or a wrong strength of the preparation, or a wrong dosage form, or due to incompatibilities, or a wrong dose, or a wrong instruction to the patient. Now, illegibility, 7,000 deaths a year due to illegible handwriting. A legal duty, courts can impose punishment. In this particular case, you can see the writing is illegible. Poor handwriting contributed to a medication dispensing error that resulted in a patient with depression receiving the anti-anxiety Buspar 10 mg instead of Prozac 10 mg. Then this is another case where a hypertensive patient accidentally received Vantin to 200 mg instead of Vasotec. Name of the drug, use caution. Look alike and sound alike drug names, which is known as LASA, like paclitaxel and doxydaxel, which we will treat later. Avoid the use of abbreviation. Always write the full name of the drug. Don't write HCT for hydrochlorothiazide or MSO4 for morphine sulfate. Now, these are some look-alike or sound-alike drugs which are known as LASA medication. Now, cisplatin and carboplatin, for example, the similarity in medication names can lead to confusion between the two agents. The doses appropriate for carboplatin usually exceed the maximum safe dose of cisplatin, and severe toxicity and death has been associated with accidental cisplatin overdose. Similarly, lower where you see these three drugs which start with C, similar spelling of these brand name drugs can lead to confusion, which in turn can lead to error. Patients affected by a mix-up between these three drugs may experience a decline in mental status, lack of pain and seizure control, or other serious adverse events. Legal action, sounding same word. This is a case of Thioril versus Thai. Dr. Y prescribed Mrs. X on 21st February 2004 tablet Thai, which is used for osteoarthritis, rheumatoid arthritis, along with certain other medications. CGHS dispensary chemist did not have the medicine, was allowed the facility of local purchase. He wrongly indented as Thioril 50, which is a Schedule H drug which is used in schizophrenia instead of Thai 75 mg. Mrs. X had consumed and her physical health deteriorated. This was a mistake and a very serious one committed by CGHS dispensary. The doctor was also said to compensate 25% of total penalty. Strength of the drug, be familiar with the dosing strengths. It should be weight-based dosing, particularly for children. Liquid medications, be familiar with various drug concentrations. Indicate both concentration and dose of medication. Example, cephalexis suspension, 125 mg per 5 ml. List of dangerous abbreviations, acronyms, and symbols. One should not write U. One should write unit, complete form. U can be mistaken as 0 or 4. Then one should not write IU. It has to be written international unit. In the complete form, it can be mistaken as IV or 10. Similarly, QD and QOD should not be written. It can be written as daily or every other day. And similarly, MS or MSO4 should not be written. It can be confused for one another. Write morphine sulfate or magnesium sulfate. Avoid errors in decimal points. Prefix zeros before decimals. Always use leading zeros. Write 0.5 instead of 0.5. Otherwise, 0.5 may be misread as 5. For example, digoxin, we write 0.125 milligram, clonazepam 0.25 milligram. Avoid trailing zeros. 5 milligram versus 5.0 milligram can be mistaken for 50 milligram. So you should avoid zeros after every number. You should write 5 milligram rather than writing 5.0 milligram. Rules for writing quantity of drug. If the drug is 1 gram or more, write 2 grams. Less than 1 gram but more than 1 milligram, write 100 milligram, not 0.1 gram. If it is less than 1 milligram in microgram or nanograms, do not abbreviate micro or nanograms. For example, write 100 micrograms in the complete form rather than writing 0.5 microgram or 100 microgram or 100 microgram. Use ml for milliliters. How much is too much? PGI Medical Board clearly revealed that Dr. XY inappropriately provided steroids to the infants. Mentioned in the report that use of clobetasol is not recommended below the age of 12 years. This was a state consumer forum's dispute where Pramod Jain Hospital versus Swaran Singh, in which the court had also made it clear that the excessive use of the medicine by the doctor was out of sheer ignorance of basic hazards relating to the use of steroids, as also lack of judgment. No doctor has the right to use the drug beyond the maximum recommended dose. Combined products. Fixed dose combination. According to the National List of Essential Medicine, as a principle, single medicines are to be preferred. Fixed dose combinations are included only if the combination is rational and has a proven advantage with respect to therapeutic effect, safety, and compliance. One has to keep oneself updated, and always you should not write Ampiclox 250. You should mention its individual components or ampicillin 125 plus cloxacillin 125 milligram. Penalty for not writing the prescription beyond usual days. This is a case of Sameer Kaushal versus Baljit Kaur. Here, it so happened that Mrs. Baljit Kaur was 69 years of age, suffering from diabetes and chronic renal conditions along with a stone. She suffered from UTI and she was given injection amikacin for twice a day for 21 days, despite complaining of hearing loss on the third or fourth day itself. After 21 days, she had completely lost her hearing capacity and had a renal shutdown and had to undergo dialysis. So the court directed the OP to pay 2.25 lakhs in the National Consumer Disputes Redressal. Direction for use, you can write out the prescription in local language or full English. One has to avoid Latin. Provide clear and specific directions. Do not write tedious. Tell the patient what you mean by 3 times a day or 4 times per day. It should be 3 times a day with the interval of 8 hours. It is better to write 7 a.m., 3 p.m. and 11 p.m. Avoid teaspoons or tablespoons. Signature of the prescriber. Prescriber's signature should be in blue ink followed by a rubber stamp. Signature with date must be closer to the last drug. No space should be left between the last drug and the signature so that it can be manipulated later. There should be complete refill instructions and no endorsement. Avoid common Latin terms that I have said that you have to write before meals. Do not write AC, do not write BID, do not write PO. Endorsement, Indian Medical Council Act. A medical practitioner shall not endorse any drug or product of the industry publicly. First time will be given a warning and thereafter removal of name from Indian Medical Register or State Medical Register. Electronic prescriptions. Electronic transmission of prescription information from the prescriber's computer to pharmacy computer is allowed, but it is at the consent of the patient. The disadvantages, there might be data entry error or divulging protected health information. Legal recognition of electronic signature. Section 4 of the Information Technology Act provides for legal recognition of electronic records and Section 5 for legal recognition of electronic signature. Legal recognition of electronic signature, the prerequisites are that the document shall be signed or bear the signature of a person, and electronic signatures affixed in place of such a signature, and the electronic signature is affixed in a manner prescribed by the central government. Virtual prescription or telephonic prescription. The bench of Bombay High Court concluded that prescription without diagnosis or without any prescription would amount to culpable negligence 304. This amounts to gross negligence from the point of standard of care and recklessness and negligence. This is a case of Deepa Sanjeev Pavaskar versus the state of Maharashtra. Here the doctor Deepa Pavaskar, she had delivered a patient. The patient later on had vomiting at home. She had delivered a patient was discharged from the hospital. Patient later on complained of vomiting, and she kept on instructing the patient's relative to go to a pharmacy and get the drug from there without a prescription. And later on, when the patient was admitted to the hospital, she kept on telephoning, informing the nurse to give her medicines without any proper prescription. And later, the patient died of pulmonary embolism that was detected on autopsy. So this was the case versus the state of Maharashtra, and the doctor was held liable. Telemedicine practice guidelines. A registered medical practitioner is entitled to provide telemedicine consultation to patients from any part of India, shall provide photo, scan, or digital copy of signed prescription or an e-prescription patient via email or on any messaging platform. Teleconsultation. Patient consent is necessary for any telemedicine consultation. The consent may be implied or explicit. If the patient initiates the telemedicine consultation, then the consent is implied. Explicit patient consent is needed if a health worker or a RMP or a caregiver initiates a telemedicine consultation. An explicit consent can be recorded in any form. Patient can send an email, text, or audio message. The RMP must record this in his patient's record. For safety, keep all copies of prescription for at least 3 years. Can have a prescription booklet or write in continuity on an A5 letterhead. Good idea to number the prescriptions, because in the court, whenever there is a case, the patient might just present a few prescriptions and say that the middle prescription are missing. So it's better to number the prescriptions. Label non-prescription papers appropriately, because sometimes the patient do present this requisition slip as prescriptions or investigation advice as the only prescription advised. So they all have to be labeled. Do not do. Printing of self-photograph or any such material of publicity on letterhead shall be regarded as acts of self-advertisement and considered unethical. However, printing of sketches, diagrams, pictures of human system is not considered unethical. Do not use another doctor's prescription pad even with his content, and do not let your prescription pad be used by any other doctor. Avoid using prescription pad having names of 2 or more doctors. Doctors should not use prescription pad with message at the bottom available at XYZ medical store. Should exercise caution while prescribing drugs which are potential of abuse. Doctors should avoid recommending medicines on telephone or SMS. Write prescriptions for family members and relatives also. Discourage them from asking for medicine without a prescription. The summary, these are the same things that I've said. The details should be printed on the prescription pad related to the doctor. The prescription serial number should be there. Details written by the doctor on the prescription related to the patients. Cross-prescribing is not illegal. Details written of the doctor on the prescription related to the drugs, the dose, the route of delivery. All the instructions should be there. Writing refill information for our pharmacist should be refilled, and doctor's signature, address, and date in blue and indelible ink should be there. Prescription should be rational, legible without abbreviations, complete, and communicated well. Thank you.
Thank you, Dr. Jharna, for such an elaborative and exhaustive covering all the aspect of the what should be the right medical prescription, and it was an eye-opening. I don't think we all are doing the same what you have elaborated in your talk. Now.